of children, and essentially central to the fulfillment of their fundamental rights as they move from childhood to adulthood. First of all, let me start in giving you a very short and brief introduction of UNICEF. UNICEF is the United Nations Children's Fund, so it's the United Nations agency which has been granted the mandate in 1946, so it's quite an old organization. The mandate to care for children, to make sure that their rights are fully respected and promoted. UNICEF started in 1946 in bringing assistance to children in Europe after Europe had been devastated by the Second World War and where millions of children were in desperate need of assistance. Later on, UNICEF moved from emergency-only interventions to also development interventions. And that's why you see in UNICEF intervening in about 190 countries around the world, both on emergency situations, bringing life-saving emergency assistance, or on much long-term development assistance. And in Egypt, UNICEF has been operating since 1952. So we passed the 60-year mark last year. UNICEF's programs around the world are mainly addressing issues of child survival, which encapsulates issues related to health, both health of the child and of the mother, issues related to nutrition, to access to water and sanitation, hygiene. We also work on issues related to education, child protection, and adolescence, to keep it short. Considering the focus of the conference this morning, I will, of course, speak about nutrition and try to share with you how important another aspect of the conference, water, how water, nutrition, health are all interrelated, actually, and how we can target those issues in a more efficient way. So I will speak about food, I will speak about water, and I will not speak about energy, but I promise to put energy into my presentation. So let's look at the situation, at the nutritional situation in Egypt these days. And we see from the year 2000 to the year 2008, a worsening of the situation. I won't go into details because this talk is not a lecture about nutrition, but if I can point out this particular aspect of nutrition, which is the stunting, which is a result of chronic malnutrition. Over years, children have not been receiving the proper food income and other various determinants of nutrition around that time. We see actually that over this time there is a net increase. And today, actually, the latest numbers show that about 1/3 of children under the age of 5 in Egypt have suffered and do suffer of chronic malnutrition. This is what we call the silent emergency. Why silent? Because very little is said about it. Not enough attention is paid to this critical issue. And an emergency because of the magnitude of the problem and the devastating impact it has on children, on their future, and of course, on the future of the country. What are the implications of malnutrition? First of all, there is a very critical moment in life of the child, which we call the first 1,000 days, or the golden interval, as we call it in our jargon, where actually everything is decided. And I will come back into that in greater details in a minute, but during these 1,000 first days of life, the 9 months of pregnancy and the 2 first years of life, if malnutrition is hitting the children, damages that occur at this particular time are irreversible. And I will come back to that in greater details. The second element is actually what I would describe as a vicious circle. Malnourished women give birth to malnourished children, low birth weight, as we call it, children who are too small and too light at birth, who in their turn will transit from childhood to adulthood with the negative impact of the nutritional challenges they have faced, and in turn will be adults with their own problem that will be transmitted to their own children. And so you have a self-perpetuating cycle there that needs to be broken at some point. Earlier presenters were talking, and I think it was Tarek, talking about the rate of anemia, for instance, among the population. If we focus at women in Egypt in their reproductive age years, childbearing age years, we realize that 50% of them show signs of iodine deficiency and anemia. So this is a real challenge. The third one is the economic impact of malnutrition. It has been estimated that if we take the figures available for 2009, malnutrition has costed to the Egyptian economy 2 points of GDP. So there is a real economic cost to this problem, and we estimate that in 2009 it was 20 billion of Egyptian pounds that were lost to this problem. Why? Because malnutrition presents, of course, a burden on the health system. It presents a missed opportunity, potentials which were not realized through education, because the children's capacity to learn and to develop have been affected by malnutrition. And of course, there is an impact on productivity with intellectual and physical capacities which have not been brought to their potential, have not developed to their potential, as learning abilities have been affected. And I think for us all, recruiting personnel and staff regularly in the country, we know that how difficult sometimes it is to find the right person for the right job. It's not entirely, of course, due to malnutrition, but malnutrition does play an impact on that. I'd like to come back to what I describe as the 1,000 first days of life, the golden interval, and show you a slide which is quite stunning, actually. And this is what I call the brain wiring. This is a picture of two brains of two kids of the same age. The one on this side, on the right side of the screen, is a child who has benefited from good nutrition. This kid was well fed, could live a normal nutritional life, if I can put it that way. And you see the neuronic connections, the brain wiring, this network that is made of interconnection that will fire ideas, innovations, and so on and so forth, well developed. In opposition, this is the brain of a child of the same age who has suffered in the very early days of severe malnutrition. And you see that those connections are not there anymore. The brain has not developed to its full potential. Why are the two first years so important and so dramatic? It's because the human brain development does develop at great scale during the first 2 years of life. We won't go into details because we are definitely, there might be some human brain development in the room, but I'm sure there will be very few. But in a nutshell, to very keep it at a simple level, here you have the three graphs that shows various stages of development of the brain. The first one is the seeing and hearing capacity, which you see actually in its development does peak around 3 months of age. The second graph here is the language, the speech capacity of the brain, which comes actually to full development around the age of 5-6 months. And the last one is what we call the higher cognitive functions of the brain, to keep it short, the rest, the abstraction capacity, the calculus capacity, and so on, which actually come to a peak of their development around 2 years of age. So this graph shows that the first 1,000 days are absolutely critical in the development of a child. So what are the main determinants of malnutrition during the 1,000-day interval and beyond the 1,000-day interval? First of all, of course, there is a health component, ensuring that the mother during pregnancy and at time of delivery, and the child, again, during the 9 months before he comes to birth, and at the time of delivery and during these first 2 years, receive the proper medical assistance and the proper access to proper medical services. Prenatal visits for women, detection of risk pregnancies that will be treated accordingly, making sure that at the time of delivery, the very simple gestures, the very simple measures are put in place and respected by the medical staff, and that some basic equipment is available during that time. So this is what I would look at, the health component of it. The second one is nutrition. And nutrition can be a very complicated factor, and we could have a conference here for 5 days looking at the different aspects of malnutrition. Well, let me summarize that for you in one sentence. Nutrition is nothing else than the right food at the right time. Making sure that the mother during pregnancy is properly fed, making sure that the child just after birth is exclusively breastfed for 6 months. When the mother can breastfeed, which is the case in the large majority of mothers, there is no better food for a child than the breast milk. And finally, that the child feeding practices are well followed by the parents. Once again, making sure that the child receives the right food at the right time in terms of quantity, but also in terms of quality. And finally, a third aspect is the aspect of access to safe water and hygiene practices. And for a child to have access to clean water and to grow into a healthy environment where the household has direct access to clean water, where there is sanitation and proper hygiene in the household, this will have a tremendous impact as well on the child life. And this is the point I'm going to further develop now. It's the water, this third component of the nexus, how water does have an important role to play in this area. Let's look first at access of water to water in Egypt. If you look at national statistics, you will find out that almost between 98% of Egyptians have access to water. So there is a quasi-universal access to water in Egypt. However, if you start digging into this information, you realize that this is far from being the case at the household level. Why? It's because most of the cases, and in all cases actually, a village is considered as covered when the main water pipe arrives to the village. And this is where the statistics stop. However, beyond that, the household connection is not done because it's left to the people themselves to pay for the connection, to make sure it happens. And we find out in many, many locations around the country that many households cannot afford the connection and therefore are not connected. And if we look at this graph on the screen, we found out that around almost 6.5 million of Egyptians do not have access to clean water. It means that roughly 1.4 million families around the country do not have a tap water in the house. They have to rely on the neighbors, they have to rely on public water places outside to fetch water. Of course, it does affect in greater numbers households in rural areas, but also to a greater extent now, and you've heard the projections of urbanization of the world population, it's affecting Egypt as well, and you see an increasing number of families living in urban areas facing the same problem. 1.5 million of Egyptians today do rely on water brought to them by carts, by trucks into their household. And a very important number here, every year in Egypt, about 5,000 children under the age of 5 die of diarrheal diseases that could mainly be prevented if they had access to clean water. And let me say that this number of roughly 6.5 million Egyptian people is a relatively conservative one. So what are the implications of access to, or the lack of access to water? One, as I mentioned, health. 9% of the deaths of children under the age of 5 years in Egypt are due to diarrheal diseases. This almost 5,000 children I was mentioning. The impact on nutrition, because diarrheas will worsen the overall situation of the child. A child who has malnutrition will be weaker than a child who doesn't suffer from malnutrition. Excesses of diarrhea will suppress the appetite of the child, so the child will be less inclined to have food intake. And the diarrheas actually prevent the body from retaining the nutrients that are so important for the development of the child, the brain, and the body of the child. Another important aspect of the lack of access to water is the time spent by children, by women, mainly, to collect water. When children are busy collecting water, it's less time they have for learning, it's less time they have for recreational activities, and we know how important they are for the development of the child. On the parent side, the time they spend collecting water is not available for income-generating activities, for instance, or other household activities and parenting activities that are so important as well. And finally, the dignity. I mean, I've been in Egypt for 3 years now. I traveled extensively in the country. I've met many of those families in villages. The aspect, the impact it has on their dignity is also very much an issue. And how many of them told me how ashamed they felt every time they had to go to the neighbors or to a public place to collect water. Of course, all that is an important issue that we try to address. And I'd like to share with you briefly some key interventions. And I will once again keep a strict focus on water, because we do have intervention more specific to health and nutrition I mentioned before. But let me, for the sake of time, only look at the water intervention. And we do have a program with government, civil society, and communities. And the private sector, actually, and one of the questions earlier was what role the private sector could play in this nexus, and I will come back to that as I conclude soon my presentation. And so we are working with those different actors to do the missing link, to do the missing connection, and ensure that the households in the villages who do not benefit yet from the water get this household connection. Usually in villages, it's of course the poorest families, the most deprived families who do not have this water connection, and it does add to the problems of poverty that they are facing every day. For that, we don't do charity. And I have nothing against charity. I mean, bringing food and water to people and other things is extremely important. But in the approach we developed with the water holding company, the NGOs, the community-based organizations, we put in place what we call a revolving fund. So we pay for the connection, and the people living in the household pay back the price of the connection every month in very small installments. So it's not charity, they own the system, they buy the system, and the money that comes back into the system is then re-injected into the system to pre-finance more connections. And so we do have this revolving fund. And it's quite impressive to see that by far the extreme large majority of the families benefiting from the program do make the point to pay back their connection fee. Over 1 year, over 2 years, we stretch it according to the capacity of the family, but it's quite a successful rate of return. And again, it strengthens the ownership of the families. It was not given to them, they own it. It is their system, and it has, of course, an impact on the dignity. Water preservation. I mean, hygiene awareness is important, as water preservation is as well. And there is a component of the program addressing hygiene awareness. And just to give you one example of that, if children and parents do wash hands with soap at particular moments of the day, after going to the bathroom, before cooking, before feeding the children, we immediately reduce by 1/2 the number of diarrhea cases for the children. And you would remember the impact diarrhea have on child nutrition and to a certain extent on child death, actually. And so with a very simple element, clean water and soap, you reduce this important determinant by half. And of course, water preservation. You've heard the voice that preceded me this morning talking about an increasing water shortage in Egypt, and therefore we all have, but also our target population for this program have to learn how to waste less water and how to be careful in using this precious and limited commodity. So, this conference is also about new technologies, about innovations which are extremely important for the future of this world and a world we will leave to our children at some point. But we can also solve some of these challenging issues like malnutrition with low technology and cost-effective technology. And for the water program, the household water connection program, what do we need? We need pipes, we need a water meter, we need taps, and we need the people to be involved in it. And the mobilization at the community level, the implications of the people themselves makes the success of such program. And I could spend another 10 minutes telling you about what it does to them, what they think about the program, what it has changed on their day-to-day life. The simple thing of having a pipe from the main pipe, a tap in the house, and someone to give them the little financial push to make it happen. But we prefer to let them talk to you directly, and we will watch and we will hear them on the video that is coming up now.
يوم ما عندناش مية في البيت بمسك الجرجر واروح املاه من الحنفية واجي تاني اديه البيت.
النور عمل قفلة والبيت كله ولع، ما لقيناش مية الساعة 3 بالليل. لو في مية في البيت ما كانش كله ده حصل، احنا خسرنا خسائر كبيرة.
مشكلتي ان انا كان عيال اطفال وما فيش راجل يبحث على المية زي ما احنا كده. كنت املى الكوبايه من بره، املى معون من بره، جركن ازود بيدي شوي.
جبنا تكاكه ركبناها بين تك منها وبقى تغسل منها، بس طلعت ميه وحشه والأول ما كناش بنشرب منها ابدا.
لما عمتي جات وعلمتنا ان تكنا منها برجلينا، ما قدرناش نعمل فيها على طول اللي انا ودعتني. راح بابا دايب الرازل عمل لنا الحنفيه وبقينا نجيب منها كل حاجه.
كانت ما تتعبنا وتوضع رجلينا، وكده لما دخلنا الميه ارتحنا يعني بقى من الترمب.
كنت كل يوم اطلع بالجردل بتاعي انا اجيب ميه. ده انت يعني الناس في الشارع يقول دي راحه كل يوم راحه جاي كلام الناس كده، يعني الواحد الحمد لله ارتاح برضه.
بعد ما ركبت الحنفية ارتحنا جوه.
الوقت ارتحنا من الطرمبات والقرف الحمد لله.
ركبة الحنفية سهلت علينا كل حاجة وقدرنا نعمل ونذاكر أنا وأخواتي مع بعضين.
أيوة كل الناس تدخل مية بترتاح بقى من الطرمبات.
ده البيت ما يستغناش عن المية، أهم حاجة المية.
نفسي يكون عندي حنفية ونملى برضه وما نتعبش.
احنا محتاجين ملايين من هذه الوصلات عشان القرى او البيوت الفقيره بالذات في مصر توصل لها ميه نظيفه صحيه، اللي هي اساس ان يكون عندك بيئه ممكن تكون صحيه. ف نداء يعني كلنا حاسين بيه انه المجتمع المدني والقطاع الخاص والهيئات زي اليونيسيف ان هم يتحدوا مع بعض في مشروع قومي حقيقي ينهي الوصله الناقصه ان توصل المياه النظيفه الى كل بيت.
So this brings us to the conclusion of my intervention. We cannot underestimate the impact and importance of malnutrition in Egypt and the weight it represents for the future of the country. And this is definitely an issue that needs to be treated as a priority. It's an issue that prevents Egypt from realizing its full potential. I was with the Minister of Youth just a couple of days ago, and I was saying in our interventions that the first riches of the country, the first riches of Egypt is its population. And at the moment, this formidable potential of a large and young population is not maximized. There is a potential that goes wasted, and it could be easily corrected. So, water has an important role to play. It's not a unique determinant as we have seen, but it's a very, very important element and a simple way to improve the situation very, very rapidly. As I mentioned, we work on that with our government partners, with our civil society partners. The mention of media was absolutely fundamental this morning, and I certainly 100% agree with that. But we also work with private sector partners. And what we are trying to achieve at the moment is to scale up those interventions, to once and for all make sure that every single Egyptian child see his and or her right to access to clean water fulfilled. Let's try to give every Egyptian access to clean water. And on that, I very much look forward to engage with and scale up our partnership with private sector companies. Some of you were asking earlier today how they can help. If you want to join this global national partnership to bring water to Egyptian children, I would certainly be very happy to welcome you in this partnership. Thank you very much. Thank you very much.
حد عنده أسئلة؟
So if